It's Asian Heritage Month. Asian Calgarians have a rich history in the city. And not just history. Each year, CBC Calgary looks at Asian Calgarians who are making a difference in the city. They're nominated and selected by people in the community. And each one of them has a story. Here are Calgary's 2024 Asian Changemakers.
You hear that from our patients all the time, that when you talk to them, you look them in the eye, you speak to them, that's the first moment they've experienced compassion in a long time. So maybe you can't really teach compassion, but by talking to people, to acknowledge their presence, to listen to them, can be hugely helpful. And so I think it's important to sort of share that compassion, pay it forward if you may, and instill that in others as well. So my name is Monty Ghosh, and I'm an assistant professor at the University of Calgary and the University of Alberta. I'm a physician, so I work with people who are experiencing health inequities and equity-deserving populations. I am also a researcher, and I do a lot of research around this area as well, especially around health inequities and substance use concerns. And then last but not least, I love to teach, so I'm a teacher. And I help teach at these schools and expose my students to the various aspects of health inequities, because it was something that I was never really taught or exposed to when I was going through school. Calling myself an Asian Changemaker is one thing, but it's not just me. I don't work alone. I don't work in a silo. It's a whole team. I work with numerous different organizations, people in the healthcare industry, in the social services community. We all do it together. I'm just one voice at the table, but it's really the collective that really makes that change. The irony is not lost on me. They call me an Asian Changemaker, but it's change makers is probably the better term, because it takes a whole community to make change in community. It's not just one person. One of my mentors, Martin Labrie, called him the original gangster, the OG, because back in the 70s, he was walking the streets of Calgary before we had not-for-profit organizations taking care of those experiencing homelessness, and he was a palliative care doctor. And talking to him about my frustration about not having difficulties getting a job, he was like, Monty, there's plenty of work to be done here in the city. Just look around you. There's tons of individuals who deserve support and help. And if you set yourself here, you can find a niche for yourself that fits you as a person that you're passionate about. One of the things that I was taught early on was that there's tons of gaps in services for this population. Those experiencing health inequities, there's tons of things that we can do for the population. There's tons of missing resources for them. And sometimes the best solutions for these gaps are solutions that this population has come up with themselves. And one of the things that was imparted to me was that if you find a gap, help empower the patient or the individual or the client to deal with that gap and empower them to address that gap. Or if they can't, address the gap yourself. And essentially what happened was, back in 2017, I was working with a patient and I was talking to him on the phone, and he was saying that he kind of uses a loan, he kind of doesn't. I'm like, well, what do you mean? And he was like, well, I FaceTime a buddy in Edmonton and we use drugs together. And so I was like, well, what happens if one of you overdoses? He's like, well, have each other's address, call 911, and emails will show up to the other person's home. Brilliant idea. And so the next step became, how do we empower this individual to industrialize this idea and make it a service for people? And so this group in Ontario had a very similar idea. They were able to get this launched on a national level with Health Canada, and they were more than happy to partner with someone like myself to help get this program started. And so now we've had over 10,000 phone calls, 100 lives that have been saved. I can go on and on with other examples, like there's peer navigation projects that are out there. There's a rapid access addiction medicine program out there within AHS. That's another example of this, where we saw there was a gap in services. The patients voiced that there was a gap, and we were able to address that gap through working with them. Something that gives me personal satisfaction is working with this population. They are the ones who achieved all of these successes, really. It's their voices, it's their projects. I might have facilitated it, and I have the education experience and the credentials to often get these projects in front of people, but it's really them who come up with the ideas, and it's them that I'm trying to support. And so that's the piece here, is that the reason why I love doing what I want to do is because it provides a meaning. It drives my passion. It's something I truly love to do, and it just keeps me going from day to day. My name is Monty Ghosh, and I'm CBC Calgary's Asian Changemaker.